Hi, so glad you could join me today. My name is Scott Camp-Schaefer, and I'm a clinical social worker here in Austin, Central Texas area. And I wanted to talk to you today about the experience of moral injury in particular, and how a particular form of therapy that I practice helps treat it, called image transformation therapy. And moral injury is something that's not very well understood and not talked that much about. It's typically thought of something as something that soldiers or people who are service members experience in the grips of war, where something bad happens and they may blame themselves for it, or they may witness something bad that happened, and there's a moral component to it that leaves them feeling guilty or ashamed, either directly or through association with it. But this is something that is experienced by a lot of people all over the world, not just people who are active service members, because anyone who has witnessed or been a party to something morally reprehensible or bad has happened, and they have either blamed themselves or they have felt some compunction about what happened. And it can happen in all levels of society and all aspects of life. But it typically occurs with experiences of depression, trauma, anxiety. Those can all go with them, and typically those are what gets diagnosed instead. However, that doesn't take away the fact that there has been a moral injury component to this situation that needs to be addressed and often gets overlooked in the process of treatment. So that's one of the things I wanted to talk to you all about today, because people can experience an immense degree of suffering because of moral injury, and it can become fatal if the person commits suicide, or they can also develop other serious mental illnesses because of it, and suffer tremendously because of this wrong that was committed or was witnessed, years ago, that's never been fully worked through. And like I mentioned earlier, people can have a lot of shame and guilt about it, but it can come out in a myriad of different ways, and that's one of it's typical of one of the ways that shame itself can hide itself and be expressed as rage or derisive laughter, or any number of other ways that it comes out. So in the process of helping people, what I often try to do is look for indications that there may be a moral injury component to whatever mood disorder or other mental illness that they're suffering from, and then try to address that with them with what's called image transformation therapy. And image transformation therapy is a breathing and visualization technique that I use. It's a newer form of therapy, but it can be good, along with other trauma therapies like EMDR, at treating the shame and the guilt, particularly, that goes with moral injury. Because especially if the person didn't have anything that they were doing that was actually wrong in the situation, and yet they continue to be bothered by what happened, there are a number of different protocols that can be used to help them process their experience of the moral injury out of their system. And if people get skilled enough at it, it's something that they can eventually do themselves. So even though this is something that can be a tremendously difficult and painful experience for people, there's all the hope in the world because of the treatments that are now developing that can be used and brought to bear on this very serious issue that, although it may have started as something that was identified for service personnel and military personnel, it has been something that can be understood as being something that a lot of people experience. So if you're one of those people who thinks you may have a problem with moral injury, I encourage you to get some kind of help for it. You may start with talking to a trusted family member or friend, but the main thing is to seek the help that you need. If you are in the Austin, Central Texas area, I encourage you to reach out to me if you think that I might be able to help you, or you'd like to find out whether I could help you, call me at the number that's at the top of my Facebook page or on the top of my web page, or you can send me an email or fill out a form on my website. But I'd be happy to talk to you more about how you can possibly get some help with what may very well be moral injury as part of another mental illness that you suffer from, but that you need not suffer by yourself, and that you don't have to suffer needlessly because of the help that you can get from many, many different places. There is an organization that meets regularly here in Austin for service members who suffer from moral injury. It happens in November, and I plan on attending that. But in the meantime, do what you can to get the help that you need, because there's no reason that you need to suffer in silence or turn to addictions or other forms of medication, self-medication, that can cover up an issue that is very, very treatable, and there's so much hope in the world for you. So I thank you so much for watching today. I wish you the best of mental health and the best overall, and I hope to see you again in this space very soon. Thanks. Bye.